The country club ballrooms sparkled with white roses and crystal chandeliers. My sister Hannah's wedding reception was everything she dreamed of. 300 guests, a 12-piece orchestra, champagne fountains flowing with Dom Perignon. I sat at table 17 near the bathrooms, one hand pressed against my chest where my mechanical heart valve clicked with every beat. Click, click, click. The sound was audible in quiet rooms. A constant reminder of the open heart surgery I'd had 6 weeks ago. The surgery my family called my little procedure. "Emma, you look exhausted," my Aunt Carol said, settling into the chair beside me. "Are you feeling all right?" Before I could answer, my mother appeared in a cloud of champagne-colored silk. Dr. Patricia Chin, Chief of Obstetrics at Seattle Grace Hospital, smiled her practiced professional smile. "Emma's fine, Carol. Just tired from all the wedding activities." Mom's tone was light but carried a warning. "You know how she gets dramatic about minor health issues." Minor health issues. I'd had a mechanical aortic valve replacement after my bicuspid valve failed catastrophically. The surgeon had cracked my chest open, stopped my heart, replaced the defective valve with a mechanical one, then restarted everything while I was on a bypass machine. But according to my parents, I was being dramatic. "I'm okay," I told Aunt Carol quietly. "Just need to pace myself." My father, Dr. Marcus Chin, renowned cardiologist and department chair at Seattle Grace, joined our table with a scotch in hand. The irony wasn't lost on me that my father was a cardiologist who'd dismissed my heart condition for 2 years. "Emma, you're not bothering the guests with your surgery stories, are you?" Dad's voice was jovial but edged with warning. "Tonight is about Hannah. Let's keep the focus where it belongs." I wasn't. "Good. Your mother and I have worked hard to make this day perfect. Try to remember that some things are more important than your medical complaints." Medical complaints. I'd been diagnosed with severe aortic stenosis 18 months ago. My valve opening had narrowed to less than 1 square centimeter. I'd been experiencing chest pain, shortness of breath, and syncope, fainting episodes that my parents insisted were anxiety attacks. "You're catastrophizing normal palpitations," Dad had said when I'd first mentioned the symptoms. "Young women don't have aortic stenosis. You're 28. It's anxiety." I'd seen 3 different cardiologists. All confirmed the diagnosis. All recommended surgery. My father had dismissed them all. Second-rate physicians looking to justify unnecessary procedures. "I'm a cardiologist, Emma. I think I know a healthy heart when I see one." He'd never actually examined me. Never ordered an echocardiogram. Never listened to the obvious murmur that had been documented by every other physician I'd seen. When I'd finally collapsed during a morning run, turning blue from lack of oxygen, my roommate had called 911. The ER doctor had taken one look at my echo and admitted me immediately. "Emergency aortic valve replacement needed within 48 hours, the ER cardiologist had said. "You're in critical heart failure. How long have you been symptomatic?" 18 months, I'd whispered. My father said it was anxiety. The surgeon, Dr. Sarah Mitchell, had performed the operation on an emergency basis. 6 hours of surgery. 2 weeks in the ICU. 4 weeks of cardiac rehabilitation. My parents had visited once, the day after surgery, to tell me I should have scheduled the procedure after Hannah's wedding. "The timing is incredibly selfish," Mom had said, standing at the foot of my ICU bed while my mechanical valve clicked and monitors beeped. "Hannah's been planning this wedding for 2 years." Now, 6 weeks post-surgery, I was sitting at table 17 while my family celebrated. My chest incision still ached. I was on blood thinners that made everything dangerous. A simple fall could cause life-threatening bleeding. I tired easily. My heart was literally learning to work with a mechanical valve that would click for the rest of my life. But I was being dramatic. Hannah floated over in her Vera Wang gown, champagne glass in hand. "Emma, you made it. I wasn't sure you'd be recovered enough from your procedure." "Wouldn't miss it," I said, managing a smile. "Well, try to circulate a bit. You're sitting here like you're at a funeral." She gestured at the dance floor. "People will think something's wrong." Something was wrong. My ejection fraction, the measurement of how well my heart pumped, was still only 45%. Normal was 55 to 70%. Dr. Mitchell had warned me I'd need months to fully recover if I recovered fully at all. The damage from 18 months of untreated aortic stenosis had weakened my heart muscle. I'll try, I said. And Emma? Hannah's voice dropped. Please don't mention your surgery. It's a wedding, not a medical conference. Mom and Dad are right, you tend to make everything about your health. I'd mentioned my surgery exactly 0 times at this wedding. My phone buzzed. A message from Dr. Mitchell. Emma, hope you're resting. Remember, no more than 2 hours of activity, then mandatory rest. Your heart needs recovery time. I'd been here 3 hours already. The exhaustion was crushing. I need some air, I told Aunt Carol, standing carefully. The room tilted slightly. Orthostatic hypotension, common after cardiac surgery. You look pale, Aunt Carol said, concerned. Should I get your father? No, I said quickly. I'm fine. Just need a moment. I made it to the terrace before the chest pain started. Not surgical pain, angina. The kind that meant my heart wasn't getting enough oxygen. I sat heavily on a bench, pressing my hand against the clicking in my chest, trying to breathe slowly. Emma. A voice I didn't recognize. I looked up to see a man in his 60s, concerned expression, doctor's bearing. I'm James Rodriguez. I work with your father at Seattle Grace. Are you all right? Just tired, I said. Recovering from surgery. Recent surgery? His concern deepened. Should you be at a wedding? My sister's wedding. I'm fine. Really? He didn't look convinced. What kind of surgery, if you don't mind me asking? Aortic valve replacement. 6 weeks ago. Dr. Rodriguez's expression changed completely. 6 weeks? You should still be in cardiac rehab. Light activity only. Certainly not a 300-person wedding reception. My family needed me here, I said simply. Your family. He stopped. Emma, do your parents know you had an aortic valve replacement? They were there. They called it my little procedure. Little procedure. He repeated the words like they tasted bad. Who was your surgeon? Dr. Sarah Mitchell. Sarah Mitchell performed your valve replacement. It wasn't a question. Emma, Sarah Mitchell only does the most complex high-risk cardiac cases. If she was your surgeon, this wasn't a little procedure. I didn't respond. The chest pain was easing slightly. Hey, Dr. Rodriguez gestured to my wrist. After I nodded, he checked my pulse. 110. Too high for someone 6 weeks post-op who should be resting. Emma, this is serious. You need to go home. I can't. It's my sister's wedding. Your sister can get married without you attending her entire reception. Your heart is more important than her party. He stood. I'm getting your father. Please don't, I said. He doesn't believe the surgery was necessary. Dr. Rodriguez froze. Your father is a cardiologist. Yes. And he doesn't believe your valve replacement was necessary. He thinks I was manipulated by surgeons looking to justify unnecessary procedures. The expression on Dr. Rodriguez's face was something between horror and rage. Stay here. Rest. I'll be back. He disappeared into the ballroom. I sat on the bench, listening to my mechanical valve click, wondering if I'd just made things worse. 15 minutes later, Dr. Rodriguez returned with Dr. Mitchell. My surgeon still wore her gala dress. Apparently she'd been attending the same event. Emma. Dr. Mitchell's voice was sharp with concern. James said you're having chest pain? It passed. I'm fine. You're not fine. You're 6 weeks post-op from emergency surgery that saved your life, and you're at a wedding reception when you should be home resting. She pulled out her phone. I'm calling an ambulance. Please don't. My parents. Your parents. Dr. Mitchell's jaw tightened. Emma, Dr. Rodriguez just told me something concerning. Is it true that your father dismissed your symptoms for 18 months before your emergency surgery? I nodded. And that he still doesn't believe the surgery was necessary? Another nod. Dr. Mitchell and Dr. Rodriguez exchanged a look I couldn't interpret. Emma, Dr. Mitchell said carefully, do you know what happens when a physician's negligence causes harm to a patient? He's my father, not my physician. He's a cardiologist who dismissed documented symptoms of critical aortic stenosis in his own daughter. Who actively discouraged you from seeking appropriate care. Who told you it was anxiety when you were literally dying. Her voice was steady but angry. That's medical negligence. And given his professional position, it's something the medical board needs to know about. Dr. Mitchell, he's my father. I can't. You almost died, Emma. If your roommate hadn't called 911 when you collapsed, you would have died. Your valve opening was 0.7 square centimeters. Critical stenosis is considered anything under 1.0. You were in severe heart failure. She crouched in front of me. What if you weren't medically literate enough to seek other opinions? What if you'd listened to him and stopped pursuing treatment? I thought about that. Late at night, when my mechanical valve clicked in the quiet, I thought about how close I'd come to dying because I'd initially trusted my father's medical opinion. The hospital gala is tonight, Dr. Rodriguez said. Medical board members, hospital administration, donors. Your father is being honored for his contributions to cardiology. The irony was crushing. I'm presenting a case study, Dr. Mitchell said slowly. Medical ethics panel. A case of delayed diagnosis in a young patient with bicuspid aortic valve disease. The presentation is in 20 minutes. I understood what she was offering. You're going to present my case. With your permission. Anonymized, of course. But Emma, the medical community needs to understand what happens when personal relationships cloud professional judgment. He'll know it's me. Yes, she agreed. He will. I thought about 18 months of chest pain. Of fainting episodes blamed on anxiety. Of being called dramatic when I was literally dying. Do it, I said quietly. The hospital gala was held in the Grand Ballroom downtown, a different venue but only 15 minutes away. Dr. Mitchell drove me herself, refusing to let me go alone. The medical ethics panel was packed. I sat in the back row wearing my bridesmaid dress, while Dr. Mitchell took the stage. Patient SC, 28-year-old female with congenital bicuspid aortic valve. Dr. Mitchell began, her presentation appearing on the large screen behind her. Patient presented with classic symptoms of aortic stenosis. Chest pain, dyspnea on exertion, syncope. Symptoms persisted for 18 months before emergency intervention. She pulled up my echocardiogram images. My heart failing, the valve barely opening. Patient sought medical attention multiple times. Was evaluated by 3 separate cardiologists. All confirmed severe aortic stenosis. All recommended surgical intervention. The next slide showed the timeline. Each doctor's visit. Each recommendation. Each dismissal. Patient's father, a practicing cardiologist, dismissed all findings as anxiety. Actively discouraged the patient from pursuing treatment. Insisted the diagnosis was incorrect despite documented evidence. Murmurs rippled through the audience. Patient collapsed during routine exercise. Emergency transport revealed critical aortic stenosis. Valve area 0.7 square centimeters. Ejection fraction 40%. Acute heart failure. Emergency valve replacement performed within 48 hours. Dr. Mitchell pulled up the surgical photos. My heart opened, the defective valve visible. Patient survived. Recovery is ongoing. However, 18 months of delayed treatment resulted in permanent cardiac damage. Patient's ejection fraction remains compromised. Full recovery unlikely. He paused, letting that sink in. This case raises critical questions about medical ethics when the physician involved is a family member. About the responsibility of physicians to recognize when personal relationships compromise professional judgment. About the consequences when a cardiologist dismisses documented cardiac disease in his own daughter because he cannot accept that she has a serious medical condition. The room was silent. The physician in question is Dr. Marcus Chin, Chief of Cardiology at Seattle Grace Hospital. Gasps. Heads turning. My father was in the front row, his face pale. Dr. Chin is being honored tonight for his contributions to cardiology. But this case demonstrates that excellence in one area does not excuse negligence in another. The medical board has been provided with complete documentation. Patient SC has agreed to file a formal complaint. She pulled up the final slide. My current echo. My heart still struggling, the mechanical valve clicking away. The patient is Emma Chin, Dr. Marcus Chen's daughter. She is 28 years old. She will live with a mechanical heart valve for the rest of her life. She faces potential heart failure, arrhythmias and stroke risk. All because a cardiologist, her own father, decided his professional opinion mattered more than documented medical evidence. The presentation ended. The room erupted. My father stood, tried to speak, couldn't. The medical board members were already converging, their expressions grim. Dr. Rodriguez found me in the back. That was brave. That was necessary, I corrected. 3 days later, the medical board opened a formal investigation. My father was placed on administrative leave pending review. The hospital launched its own inquiry into his competency. Hannah called furious. You ruined Dad's career. At a medical gala. How could you? He almost killed me, I said simply. Medical negligence has consequences. It wasn't negligence. He's a cardiologist. He knows hearts. He knows hearts. He just didn't care enough to actually examine mine. My mother called next. Emma, this is destroying our family. The hospital is talking about revoking his privileges. The medical board wants to suspend his license. All because you held a grudge about a difference of medical opinion. A difference of opinion? My mechanical valve clicked loudly through the phone. Mom, I almost died. The surgeon showed my charts. The valve area was 0.7 centimeters. That's not a difference of opinion. That's negligent homicide that failed because I got lucky. Silence. The medical board hearing is next month, I continued. Dr. Mitchell will testify. So will the 3 cardiologists I saw who all diagnosed the stenosis. So will the ER doctor who admitted me in heart failure. And so will I. Emma. I'm done being called dramatic for having a serious medical condition. I'm done being told I'm making things up when I have a mechanical valve clicking in my chest 24 hours a day. And I'm done protecting Dad's reputation at the expense of my health. The hearing took 3 weeks. The medical board reviewed every record, every dismissal, every documented instance of Dad ignoring medical evidence. The final ruling: 2-year suspension of medical license. Mandatory ethics training. Supervised practice review upon reinstatement. Formal reprimand in permanent record. Dad lost his department chair position. The hospital declined to renew his privileges even after the suspension ended. My parents didn't speak to me for 6 months. Then one afternoon Dad showed up at my apartment. I've been going to therapy, he said, standing in my doorway. The medical board required it, but I continued because I needed it. Oh, I'm sorry. I was wrong. I let my ego and my fear cloud my judgment, and I almost killed my own daughter. Yes, I agreed. You did. Can you forgive me? I listened to my mechanical valve click. Click, click. I don't know yet, I said honestly. But I'm willing to try. He nodded, tears in his eyes. That's more than I deserve. Took 2 years, but we rebuilt something. Not what we'd had before. That was gone, destroyed by negligence and pride. But something new. Something honest. Something built on the truth that sometimes the people who should protect us are the ones we need protection from. And sometimes the only way to heal is to demand accountability, even when it costs everything. My mechanical valve still clicks. A permanent reminder of what happened when a cardiologist forgot that medicine requires humility. But I'm alive. And finally, my father understands the difference between being a doctor and being a father who happens to be a doctor. The hard way. The only way he'd learn.